Welcome to the Ernie Chambers Show.
Brothers, sisters, friends, enemies, and neutrals, last time I was talking about the increase in the number of COVID cases in Nebraska, the number of people who get COVID, the number of hospitalizations, the number of people who died at a time when the CDC has relaxed rules and requirements relative to quarantining and social distancing. I'm not going to review and repeat all of that, but I do want to give something that was stated by a person whose credentials I have confidence in. And this is Dr. James Lawler, a co-executive director of the University of Nebraska Medical Center's Global Center for Health Security. This is from an article that appeared in the paper on the 19th of July, last month. Dr. James Lawler said the majority of hospitalizations are occurring in those over the age of 65, but increases in hospitalization are occurring in other age groups as well. In some regions, children now are hospitalized at the third highest rate of the pandemic, behind only the Delta and Omicron waves. And yet children are going to be going to school where safety requirements are relaxed, masking, testing, and so forth. But the children are being hospitalized. In Health and Human Services Region 7, which is made up of Nebraska, Iowa, Kansas, and Missouri, hospitalizations among children are at Delta levels, Lawler said. And that's coming at a time when school, a known driver of viral spread, is not in session. He's suggesting that when it is in session, you can imagine the uptick. Quote, where our elderly have benefited from relatively higher rates of vaccination and boosting, our younger populations don't, and so have seen higher rates of severe disease and infection, he said, among the children. I'm wondering what kind of policies will be adopted by OPS in view of this kind of information. And they don't have to take my word for it or what's read in the newspaper. They can have direct access to the officials, to the doctors, to the experts at UNMC, which has an international reputation for quality. The first, Lawler said, is staying up to date on vaccines. These are the tools to use. He said the tools to fight the pandemic are the same ones that have been working all along. We just need to actually use them. The first is staying up to date on vaccines. Nebraska 65 and older, I'm in that category, rate with 2 booster shots. Let me start that again. I was thinking of something. Nebraska's 65 and over rate with 2 booster shots ranks 18th among the states. Iowa is 13th at 29%. Minnesota at 38% has the nation's highest 2 booster rate. Dr. Lawler said people also need to go back to using tools that have helped slow transmission in the past, including avoiding large crowds, crowded gatherings, particularly indoors, masking in large public indoor gatherings, and testing routinely, especially when having symptoms. People should stay home when having symptoms and when positive. CDC said you don't need to quarantine if you've been around people, but if you have symptoms and if tested positive, I guess CDC would agree that you should stay home. All of those measures have worked when people have done them together. Quote, the issue with pandemics, it's a team sport, Lawler said. It does not work if only a couple of people do these things. Everybody really has to do them together. Taking such steps together, he said, will significantly reduce transmission in the community, avoid more hospitalizations and deaths, and head off long COVID and other lingering effects. Researchers are learning that long COVID can accompany mild and moderate infections, not just serious ones. Long COVID are these hangovers, if you want to call them that. Without many people taking such measures, doctor said, waves will continue until researchers can devise a vaccine that provides longer and more broadly effective immunity. But if a person is thirsty and will not drink water, the thirst not only stays, but it grows increasingly severe. The currently available vaccines, the doctor said, work well when people stay up to date on the shots. They also continue to prevent serious illness. New variants, for that matter, appear to be spinning out more quickly as time goes by. Earlier in the pandemic, new variants were emerging roughly every 6 months. But by March, BA2 had replaced the original Omicron that rose in December and January. BA4 and BA5, a highly transmissible subvariant now dominant in the US, began rising in May. Now scientists are watching two new Omicron subvariants, BA2.75, which has been detected in the US, and BA5.2.1. People can and are getting infected multiple times, Dr. Lawler said, and those infections don't necessarily carry a lower risk of long COVID or hospitalization. Quote, just ignoring the problem and pretending it's gone away does not solve anything, he said, because it has not gone away. Nebraska reported 18 more COVID deaths last week, bringing the total number of confirmed or probable deaths to 4,363 for the 2-year pandemic. Nearly 510,000 positive tests have been reported in Nebraska. That doesn't sound to me like things are getting better. As for the children, in May, this article appeared in the World Herald. Booster urged for kids ages 5 to 11. Growing evidence shows 3 COVID-19 shots is most effective. Kids ages 5 to 11 should get a booster dose of Pfizer's COVID-19 vaccine, advisors to the U.S. government said Thursday. The CDC quickly adopted the panel's recommendation, opening a third COVID-19 shot to healthy elementary age kids, just like what is already recommended for everybody 12 or older. Now they're recommending that regimen or regime for kids under 12, 5 to 11, in other words. The hope is that an extra shot will shore up protection for kids ages 5 to 11 as infections once again are on the rise. And now that they're on the rise, teachers don't want the regulations in the schools. What are you going to do? Quote, vaccination with a primary series among the age group has lagged behind other age groups, leaving them vulnerable to serious illness. So these at the lower grades are subject to more serious illnesses and to being carriers at a time when there's a relaxation of the rules regulating what happens at these grade levels. Quote from Dr. Rochelle Walensky, who is the CDC director: "We know that these vaccines are safe, and we must continue to increase the number of children who are protected by them," unquote. Earlier this week, the Food and Drug Administration, FDA, authorized Pfizer's kid-sized booster to be offered at least 5 months after the youngster's last shot. The CDC takes the next step of recommending who actually needs the vaccines. Its advisors debated if all otherwise healthy 5 to 11-year-olds need an extra dose, especially since so many children were infected during the huge winter surge of the Omicron variant. But the US now is averaging 100,000 new cases a day for the first time since February. And ultimately, the CDC's advisors pointed to a growing evidence from older kids and adults that 2 primary vaccinations plus a booster are providing the best protection against new variants. The main one and 2 boosters. Quote, "This always perhaps should have been a 3-dose vaccine," said Dr. Grace Lee of Stanford University, who chairs the CDC's advisory panel. The booster question is not the hottest vaccine topic. Parents still are anxiously awaiting a chance to vaccinate kids under 5, the only group not yet eligible in the US. Dr. Doran Fink of the Food and Drug Administration said the agency is working, quote, "as rapidly as we can," unquote, to evaluate an application from Moderna and is awaiting final data on the littlest kids from Pfizer. The FDA's own advisors are expected to publicly debate data from one or both companies next month. So that would mean they started that debate in June. Now I'm doing all this talking about vaccinations. So let me read from my COVID vaccination record and all of my shots I got through Charles Drew. Dose number 1, Moderna, I got it in February of 2021. Second dose, Moderna, March of 2021. Other shots, Moderna, I got in December of 2021. And this year, I got a Pfizer shot June 28th. So I've had 4 shots. I'm not just saying what others ought to do. I practice it myself. I'm going to go through some of the things that I have done in the past when there were problems with diseases. Problems because the disease carried a stigma. People did not want to be branded. They did not even want to take the test for fear of somebody finding out they took the test. And in America, you take the test, that brands you. And people with these diseases are not diseased things. They are human beings who are ill. The diseases offer treatment. In the early stages of some diseases, there is no known treatment and people die. But scientists, doctors are continuing to work to bring healing. And we have idiotic people saying that these discoveries, these advancements in medicine and in the scientific arena are fallacious. They're false. They should not be adhered to. This is an article from long ago, 2005. It's now 20 22. I went to OPS, but I know that 5 from 22 is 17. This is what I did 17 years ago. And the headline, Chambers IV test. State Senator Ernie Chambers demonstrated Tuesday how one takes an HIV test. That's the human immunovirus, or whatever that I stands for, immunodeficiency virus that causes AIDS. The test for it. Go to the Charles Drew Health Center in North Omaha, fill out a form, extend an arm. Tell a quick story while the assistant draws blood. This is what I did. And the reporter's giving the account. Her name was Erin Grace. She no longer is with the World Herald. Now that I've given that background, go to the Charles Drew Health Center in North Omaha, fill out a form, extend an arm, tell a quick story while the assistant draws blood. Pocket an orange card with instructions and a number to call in 1 week for results. Quote, it's very quick, it's painless, it's confidential, unquote. Chambers said Tuesday morning after undergoing a blood test to raise awareness about the importance of being tested for HIV, the virus that can turn into AIDS. And AIDS was a killer. Chambers scheduled an appointment and invited reporters to his HIV test because of the spike in new infections, particularly among minority women, and the reluctance many have to get tested for reasons I touched on. But as with everything in this society of a medical nature, we suffer from it out of all proportion to our numbers. We get treatment less than any other group in this country. That's from pregnancy, childbirth, diseases, kidney failure, HIV, name it. And we'll have a greater or worse onset of it, an infection rate than any other group in the society. Chambers used Tuesday's event to say the virus is treatable. Testing is easy, and anyone in a public position, from lawmaker to preacher, should be adamant about addressing this health issue of such profound gravity. By getting tested, Chambers joins a number of public health advocates who are trying to address higher than average rates of sexually transmitted diseases in North Omaha. This is where I live. It's where my greatest concern must be. Charity at home, then let it spread abroad. But we don't have the wherewithal, even when we're aware of these problems, to address them. Those whose job it is, whose oath, whether it's as a medical professional or a politician to uphold the law and Constitution and all the things that flow from that, are not interested in us. But a sidelight, can you imagine what would happen to Black people if we started taking military-style weapons to FBI offices, making threats? Can you imagine what would happen to us? What would have happened if Black people were the ones who had assaulted the Capitol January the 6th? We all know that white people get away with murder, and they commit more murders. We wouldn't dare advocate publicly the killing of various people. And when I say advocated, I don't mean you say they ought to be blown away, but say we are going to do it. Let me go on. HIV can be transmitted sexually or through contact with infected blood. Babies born to HIV-infected women also are at risk either before or during birth or through breastfeeding. The only part of Chambers' HIV test that was far from normal was the presence of cameras. HIV tests are confidential and can be taken anonymously. Chambers chose to go public because HIV, quote, is with us and not going away, unquote. Quote, we need to face it, he said. 2 TV cameramen and a newspaper photographer and reporter crowded into Chambers' exam room. Quote, would you like to do confidential or non-confidential? Asked Anwan Thomas, a medical assistant. I'm going to do it open, Chambers said. Thomas, and how old are you? Chambers, 67. And that was so long ago, if you reverse that and make it 76, I'm still older than that at this point. Thomas, and your zip code? Chambers, 68110. Thomas, the next questions will be a little personal. Chambers chuckled at the next question about sexual activity. Quote, that is personal, he said, and filled out the rest of the form quietly with Thomas. Thomas tied an elastic band around Chambers' bulging right biceps, told the senator he would count to 3, and then pricked his arm. In seconds, the senator was holding a cotton ball on the puncture site and laughing about how needles made a few fellow soldiers in the army turn pale and nearly pass out. And that was not an exaggeration. And we were getting multiple vaccinations in each arm. And you better get those vaccinations. And now you got these idiotic people running around here saying that vaccinations are evil. But let me go on. He was given a Garfield Band-Aid, a sticker with a blue hippo that read, quote, I got a shot, exclamation point, and walked into the clinic's waiting room, which by 9:20 a.m. was full. Quote, I've got to hit the road, he said to Charles Drew's CEO, Richard Brown. Thank you for letting me use your facility, unquote. Brown said testing is easy and vital. Quote, it's important for people to be responsible and protect themselves and their loved ones, he said. The World Herald, which in those days made it no secret about how much contempt they had for me, printed a brief editorial titled Leading by Example. We commend, and it appeared June 30th, 2005. We commend State Senator Ernie Chambers for going beyond talk and taking action in the fight against the spread of HIV. Sexually transmitted diseases are occurring at higher than average rates in North Omaha, the district Chambers represents. One of the best ways to combat the disease or the spread is through testing, though motivating people to do so is not always easily accomplished. Chambers illustrated the importance and ease of testing by getting tested himself at the Charles Drew Health Center. The Centers for Disease Control and Prevention estimates that as many as 280,000 people nationally are unaware of their HIV positive status. It's particularly affecting African Americans and Latinos, as well as gay men. HIV and other STD testing, unfortunately, can evoke fear and shame for some people, but it shouldn't. Thanks to the concern and openness by Chambers, others should see that getting tested, acquiring knowledge about one's health is an essential, potentially life-saving act. There can be nothing legitimately embarrassing about that. So let's update to March 4th, 2021. Chambers gets vaccine, hopes to set example. There was all this craziness out there. So this is the World Herald's coverage of that first shot I got, again through Charles Drew. Ernie Chambers rolled up his trademark short sweatshirt sleeve Wednesday morning, revealing a well-defined bicep that people less than half his age would envy. You see that arm? Chambers told the nurse preparing to give him a COVID vaccine shot. That's the arm of an 83-year-old man, unquote. As the nurse, Trevor Beecroft, guided the syringe toward that buff arm, Chambers jokingly yelled, "Ouch!" before the needle even reached his shoulder. The laughter had barely subsided before the shot was delivered. "That's it," Chambers quipped. The former dean of the Nebraska legislature from North Omaha received his second dose of the Moderna vaccine Wednesday. Chambers took the jab to his right shoulder in a Charles Drew Health Center clinic at the Omaha Home for Boys. It's a campus in North Omaha. I didn't realize that was my second one. I was thinking it was my first one. Anyway, never one to pull his punches in criticizing government or any other institution, Chambers sought to use his reputation as a state senator who spoke his mind to show people he believes the vaccines are safe and necessary. Quote, "This is so important to me that Black people, Latino people, older people get information from a source they might have confidence in. There are people among those groups who do have confidence in me and what I say. I cannot find the words strong enough to encourage people to get the vaccination. And my view is the greatest evidence of my belief is the fact that I'm getting the vaccine, excuse me, myself." Why did Chambers get the vaccine? First, to maintain his health, he said, dropping to the floor of the clinic and doing 20 push-ups to demonstrate the importance of that to him. Second, to protect other people, which is why he intended to keep wearing a mask and social distancing. Quote, "When I became aware of the virus and that there was a vaccine available that was scientifically based, I determined to get it as soon as possible," Chambers said. "Prevention is better than cure." He said he believed Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, about the coronavirus and the importance of safety of vaccinations. Quote, "I didn't have any trepidation that other people had," Chambers said. And by the way, one thing that convinced me I've got to get vaccinated, if I had any doubts, was when Trump said, "All of this is a hoax," unquote. For those who believe they don't need the vaccine, Chambers said, "COVID-19 is deadly, and quote, if you think the vaccine cannot help you, it certainly cannot hurt. Don't take the risk," unquote. Kenny McMorris, CEO of Charles Drew Health Center, took a picture of Chambers after he got the shot. Quote, "Let's get you a flex photo here, Senator," McMorris said. "All right, COVID strong." Quote, continuing his quote, "There's a significant amount of hesitancy, so anything you can do to demonstrate, especially in terms of people of color, representation matters." Chambers' example will go a long way with making the community comfortable with taking the vaccine, said McMorris. As Chambers prepared to leave the clinic, Ted and Layla Johnson arrived. Ted had already received his first dose through the VA Nebraska Western Iowa healthcare system. Layla was coming for hers. Ted Johnson, 76, said he works with a lot of people who are skeptical of the vaccine, in part because of government and healthcare mistreatment of Black people. On Wednesday, he gained a new point to make his vaccine hesitant friends. "I'll say, hey, look at this. Senator Chambers He's one of the most skeptical people in Omaha, Johnson said. If he can get it, what's wrong with you? And Johnson was right. What's wrong with you? And I'm not the only one who took a vaccination, kind of be an example. This is from a magazine called New Horizons, March of last year. And it's an old folks magazine, but young folks read it. And this is an ode that I wrote to the superintendent of schools. Ode to Superintendent Cheryl Logan by Ernie Chambers, March 2nd, 2021. Once there was a superintendent motivated by intendment to ensure that educational quality prevailed in schools, and her conduct gave a sample of her leading by example, which evinced determination to adhere to her own rules. And here's the article. Omaha Public Schools Superintendent Cheryl Logan, Doctor of Education, thought about her mother as Dr. Logan filled out the paperwork, then got her first shot to take part in a national clinical trial to test the safety and effectiveness of an investigational COVID-19 vaccine for adults. She went beyond what I did. Hers was a clinical trial. The shot that I took was a result of trials and testing. The University of Nebraska Medical Center and its primary hospital partner, Nebraska Medicine, are involved in the trial to test an investigational protein-based vaccine created from the coronavirus spike protein and an added component that boosts a person's immune response to stimulate higher levels of antibodies. UNMC and Nebraska Medicine are working with the COVID-19 prevention network formed by the National Institute of Allergy and Infectious Diseases at the U.S. National Institute of Health. Dr. Logan's mother took part in a clinical trial 20 years ago after having been diagnosed with multiple myeloma. Quote from Dr. Logan, "My commitment to medical research is more about who else it is going to help," Dr. Logan said, "and it was modeled by my own mother," unquote. The vaccine candidate was developed by Novavax, Inc., a U.S. biotechnology company which plans to enroll 30,000 adults in the study from the United States and Mexico. The investigational vaccine requires 2 shots given 3 weeks apart. 4 additional follow-up visits are required during the first year and 2 during the second year. Quote, "This vaccine does not contain live or inactivated virus, so it does not cause infection," said Diana Florescu, MD, professor and infectious disease specialist in the UNMC Department of Internal Medicine. That's a mouthful. Who is leading the trial at UNMC. Quote, "The first shot felt like a flu shot," Dr. Logan said. "Arms a little stiff, but that's normal. I'll be back lifting weights tomorrow and working out. I don't have any worries about the side effects or anything like that," unquote. Dr. Logan said OPS students have 2 choices in life when faced with something difficult. Quote, "You can throw up your hands or you can roll up your sleeves," unquote. Researchers are looking for people aged 19 and older who haven't had COVID-19, who are not pregnant, breastfeeding, or planning to become pregnant over the next 4 months, and who may be at an increased risk for exposure to SARS-CoV-2 infection, including people who work in essential jobs and those who have other medical conditions and comorbidities. By the way, speaking of essential jobs, many Latinx people work in what are called essential jobs. That means these meat packing plants. And I always say the work is essential, but the workers are expendable. The health, the safety and welfare of these workers, not only before COVID came along, has never held a high priority. They were looked at by the ones who run these companies as interchangeable, expendable parts in a machine. Wear this one out and replace it with another of like or higher quality. This article is dated December 12th of last year. After a shot, Chambers pumps out 30 push-ups. Here I am getting another shot publicly to try to encourage people to get this thing done for their sake and the sake of those people they are around, their family, friends, church members, on and on and on. We are, or should consider ourselves, to be our brothers and our sisters' keeper. And to the extent that is possible, we should fulfill that role, and we should never intentionally or negligently do anything to hurt our brothers and our sisters. And when I say brothers and sisters, I mean in this broad context, anyone born of a man and a woman is my brother if a man, my sister if a woman, in disregard of everything else, race, religion, sexual orientation, or any other consideration like a label that is attached to people. Former Nebraska State, oh, that's right. I was out of the legislature by then. But as has been pointed out, I was so effective in the legislature that white people changed their constitution and their form of government to get me out. They amended the constitution so that and they admitted it was aimed at me, could not serve more than 2 terms back to back. And then I would have to sit out 4 years before I could come again. Well, I was the check and balance in the legislature, on the legislature, to stop them from running roughshod over all you out there who voted to get me out of the legislature. The legislature in the governmental structure was the check and balance on the executive and the judicial branches. With me gone and with others not able to stay more than 8 years, the legislature as an institution was weakened. Excuse me. And thereby they weakened their system of government. They hate us that much and feared me that much. Let me scamper through this. Former Nebraska State Senator Ernie Chambers pushed aside his signature short-sleeve sweatshirt Thursday and flexed his arm before getting a booster dose of the COVID-19 vaccine. To show that he felt just fine after the jab, he dropped and gave the staff at Charles Drew Health Center 30 push-ups. Chambers, 84, said he wants to be an example to others, especially those in the Black community. Quote, I'm hoping that the people who may have some regard for me and what I recommend will see that I myself took 2 shots, took my booster. They may be inclined to say, if he did it, then I think I'll give it a try also. Over the course of the pandemic, Chambers said, he has been a fairly regular guest on his daughter's podcast. He talks about misinformation surrounding COVID-19, which he has dubbed Cyrus the virus. Chambers said he tries to relate things back to common biblical passages. When Chambers was at Charles Drew for his booster, he said several people thanked him for what he was doing, but he was moved by an 11-year-old girl who he said was, quote, enthusiastic about receiving her vaccine. Chambers said he told the girl, quote, if I had not been of a mind to get a vaccination, but I saw somebody like you getting this, it would have made me do it, unquote. I like to encourage children. Children are my heart. I've had children come to my office or had them when I was there. One little boy was autistic and he came into the office and I had a suite of offices that time. He ran right through the front office saying, Ernie, 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 and looked around and he saw a door open and ran in there. And there I was at my desk and he ran and climbed up on my lap, autistic. But he understood enough to know where he wanted to be, what he wanted to be, who he wanted to be with, and what he wanted to do when he got there. Chambers said he had no side effects for either the first or second dose of the Moderna vaccine, no headaches or wooziness, and not even a bit of soreness. After each of those doses, I mentioned the push-ups to show I'm in good health, but I still take whatever precautions I can. Chambers decided to show off Thursday by tacking on an extra 5. That was met with oohs and ahs from those in the health center. Quote, the idea with COVID is that you can have the virus and be asymptomatic like typhoid Mary, he said. If you have family members or friends or circulate around other people, we should show that consideration. And because of the possibility that I could be asymptomatic, I take all of the shots when they're due. I keep this record and I have it and I practice what I preach. And this little girl would be a fulfillment of another verse, and it comes from Isaiah, and I mentioned it earlier. A little child shall lead them. This child was showing old people the way. But I'll conclude this with that saying, you can lead a horse to water, but you can't make him drink. You can lead a fool to school, but you can't make him think. So at this point, having filled out my allotted time, I will end by quoting the canary who was advised that the cage door was ajar. Said the canary, I'm out of here.
Thank you for watching The Ernie Chambers Show. If you'd like to make suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.